So just over 100 years ago in Vienna, a man called Sigmund Freud invented, if you like, mental health. He began to talk to patients instead of treating them like a normal doctor would, and developed a view that there was something about talking to people that could help them recover from symptoms that otherwise were a bit confusing to the medical establishment. And this became known as the talking cure, or talk therapies. It's interesting to think for a moment about the kinds of problems he was trying to address. They sound pretty weird by modern standards, but for example, he dealt with things like mysteriously paralyzed limbs. He had, for example, a housewife in Vienna who seemed to have a paralyzed arm, and there was no medical reason anyone could find for this paralysis. His idea was that these were what he would call neurotic symptoms. This is a way of the body expressing something that the mind couldn't do. And that's why he wanted to talk to the patient, talk through the problem, see if it could be cured that way. It's led to over 100 years of this thing that we call psychology. And really in psychology, we spend our time looking at problems and trying to categorize them and to understand them more from the point of view of observation and from the point of view of cause and effect. It wasn't particularly clear to Freud or anyone subsequently why these things were happening, but what they noticed was that if they tried to start to talk about the problem, things could sometimes shift and change and get better. So it slightly raises the question, what is mental health treatment compared with, for example, physical health treatment? And it really raises the question from there, what is a mind? What is the thing that is being treated in healthcare when we talk about mental health treatment? The whole issue is very similar to an issue we discussed in another video about the difference between medically unexplained and medically explained symptoms in healthcare. So if I was to go to the doctor and say, my foot is hurting, and he said, well, I'll have a look at your foot and I found a thorn in your foot, then that's an explanation and everyone's clear what the problem is and therefore what to do about it. But if he just said, well, you've got hurting foot syndrome, and that was my diagnosis, then it wouldn't be clear why my foot hurt or what to do about it. This is a standard problem in physical healthcare, but it seems to me that the entirety of mental health care is the same. And it's like a special subset of medically unexplained symptoms. So rather than say you've got hurting foot syndrome, I might say, you've got anxiety, or you've got depression, or you've got borderline personality disorder, or whatever. And there's an enormous book that's been developed that makes these classifications called the Diagnostic Statistics Manual, also known as DSM, which is currently on its 5th volume called DSM-5. And it lists hundreds and hundreds of these kind of slightly quasi-quack sounding disorders, like, for example, hoarding disorder for somebody who is hoarding too much stuff in their house or in their life. The problem I have with this is it doesn't really tell us anything other than what the patient tells the doctor. So if I go to my doctor and say, I'm hoarding things all the time, and he tells me I have a hoarding disorder, we haven't moved on. We've got no further down the path. And this is very similar to what happens in physical healthcare in medically unexplained symptoms. So it could be that the entirety of what we call mental health is in fact just an extension of what doctors in physical health call medically unexplained symptoms. Which is fine, and if that's the best we can do, that's where we are, and it often is the best we can do in physical healthcare. But the problem with it is when it's presented as if it's not that. So when psychology or psychiatry present these diagnoses as if they explain something when they don't, what it does is it robs us of the curiosity to go and find that explanation. And it also robs us of the opportunity, if we find that explanation, to therefore suggest a course of action which may cure the problem. Now, I think nervous system theory offers that opportunity and that hope and that possibility to make transformational treatments in people's lives. So there's so many things in mental health care and in the diagnosis of mental health care which will tell you that something is too much or something is too little or something is going too fast or too slow. Anxiety and depression are the obvious candidates. Anxiety is when my nervous system is too elevated, and depression is when it's too deflated. But you can also think about bipolar as a mixture between the two. OCD is another one. Obsessive compulsive disorder is often referred to as someone responding to a threat all of the time. And in nervous system theory, we talk about threats all of the time. Borderline personality disorder, this could be called I'm running away from an invisible lion disorder. That when you start to look into the heart of all of these disorders, you start to see that the behavior, if you can imagine that there's a threat that's either being responded to in an active way or overwhelming someone in a passive way, it begins to explain not just their behavior, but their thinking, their relationships, and even the biochemistry of their body. So there's so much opportunity in this area we call mental health to reinterpret symptoms and therefore reimagine treatments by looking at what is the nervous system of the client doing, what is the nervous system experiencing, what is the nervous system going through, and can I understand that with this idea of the invisible lion? So could it be that there was a threat 30 years ago that this body is now responding to, and that's why they're behaving the way they're behaving, and why they're having the relationship they're having, and why they're treating me the way they're treating me? And the advantage of doing this is you start to see it as a chain of dominoes now, rather than just a presentation of symptoms. And you can begin to think that if you can see the chain of dominoes, then it's causal. One thing causes another, which causes another, which causes another. And if you believe in that, then you can go back to the original cause and you can try to fix it. So for most of these things, the way we understand this, if we understand the nervous system, is we understand a client has a dysregulated nervous system. They're either their accelerator is on too much or their brake is on too much. And as a result, there's many things go wrong or change in the body. The biochemistry, the behavior, the presentation of symptoms comes out of that. So hoarding disorder is another good example. If I feel like I'm constantly unsafe, then it makes sense to hang on to everything I ever buy. Because one of the reasons we buy things is to have resources to keep ourselves safe. So in the realm of what we call mental health, I think it might be worth thinking about the idea that everything that is called mental health is in fact a medically unexplained symptom. And it's a specialist branch of the general physical health problem of medically unexplained symptoms. And we can begin to provide an explanation, provide a causal explanation by understanding the nervous system theory, its dysregulation, and the over and under reactions that therefore causes in our life in the here and now. The consequences of that on our sense of reality, the consequences of that on our behavior, and how that drives our relationships to be different to how they otherwise might be. So the good news is that it doesn't all have to be unexplained anymore. And the more we can explain it, the better we can design treatments to help it. Thank you for watching this video. I'm Benjamin Fry, and these are some of the ideas from my recent book, The Invisible Lion. You can find more about the book at theinvisiblelion.com.